You can take action to prevent cervical cancer and catch it early. Cervical cancer is caused by HPV, which is also known as the human papillomavirus. Over 80% of Canadians will get an HPV infection. Most people will never have symptoms and will clear the HPV infection on their own. But in some people, HPV can cause abnormal cells to grow on the cervix that may turn into cervical cancer. The best ways to prevent cervical cancer are to get vaccinated against HPV and get screened for cervical cancer every 3 years with a Pap test. The Pap test checks for abnormal cells on the cervix. Most women, trans, non-binary, and gender-diverse people with a cervix who are aged 21 to 69 and have ever had sexual contact should be screened regularly with a Pap test every 3 years. Sexual contact, either wanted or unwanted, includes skin-to-skin contact between one person's genital area and another person's genital, anal, or oral area, as well as sex with shared sex toys. Here's what you can expect during your Pap test. On the day of the appointment, wear an outfit with a separate top and bottom. You should also bring your Manitoba health card. When you enter the clinic room for your appointment, your healthcare provider will ask you to remove your clothes from the waist down and cover your legs with a sheet. You will then be asked to lie on the exam table and place your feet in footrests. Your healthcare provider will insert a speculum into your vagina and open it to examine your cervix. The speculum may feel cold, and you may hear a clicking sound. This process can cause some discomfort. If you feel pain or have any questions or concerns during the test, let your healthcare provider know. Next, your healthcare provider will collect cells from your cervix using a small broom, and then remove the speculum. The test is now done. Your sample will be sent to a lab to be checked for abnormal cells. The test result will be sent to your healthcare provider in a few weeks. You can call them to ask about your result, or you can request a copy from Cervix Check. If the result is normal, it means that no abnormal cells were found. Cervix Check will send you a letter in 3 years to remind you to book your next Pap test. If the result is abnormal, it means that you need to follow up to understand and possibly treat the abnormal cells. In some cases, your Pap test sample will be automatically tested for HPV. Abnormal test results are common and do not necessarily mean that you have or will get cervical cancer. If the abnormal cells are treated, it can stop the cells from growing into cancer, so it's important that you attend all appointments. To make an appointment for a Pap test, call your healthcare provider. If you do not have a healthcare provider, you can find providers who do cervical cancer screening at cancercare.mb.ca/cervixcheck. If you want a female healthcare provider, need help with mobility, or need an interpreter, ask when you book the appointment. Remember, the best ways to prevent cervical cancer are to get vaccinated against HPV and to get screened for cervical cancer every 3 years with a Pap test. If you have any questions about cervical cancer screening, call Cervix Check at 1-855-95-CHECK or visit cancercare.mb.ca/cervixcheck.